there has been an injury to the tissue, there has been release of certain chemicals. To revise again, the chemicals are histamine, 5-hydroxytryptamine, substance P, prostaglandins, CGRP. Okay, so they are actually stimulating my free nerve ending, which is going via the dorsal root ganglion, going to which area? To the substantia gelatinosa. Fine. So now I have the C fibers, which is nociceptive fibers. The C fibers is for my slow pain, and I have the A delta fibers for the fast pain. So let us now go on to the analgesic. So this was the pain pathway. This is how the pain is being perceived, and this is how it goes. Then comes to the analgesic pathway, pain reducing pathway. How is that? For time innumerable way, from the history we know that whenever we have a pain, massaging that area or caring for that area. So we have seen, small kid, when they get injured, they run to their mother. What does the mother do? She cares the child, she consoles the child, she rubs that area around the injury, and that actually reduces the pain. So how that reduce the pain? We can explain it via a theory, what we call as the gate control theory. For that, we have to understand certain things. So what does the gate control theory says is that when you are kind of applying a non-noxious stimulus, like you are, kind of cursing that person, you are rubbing that area, or you are just, kind of, moving your hand over that area, or you're just consoling that person, what exactly you're doing? You are stimulating the mechanoreceptors, your touch receptors. Okay, so you are actually stimulating your touch receptors, which are being carried by the myelinated nerve fibers, that is A alpha or beta axons. So those are actually your mechanoreceptor carrying sensory fibers. So let us now go on. If there is a pain, here is the pain. Okay, the pain has stimulated my nociceptors, and the nociceptors are being innervated by the C fibers. So C fiber is now carrying the action potential of pain. So that goes and gives, this is the substantia gelatinosa, they have to give the second order neuron. So they go and terminate to the projection neuron, they stimulate it. So we know if it is a C fiber, it may give glutamate, which is a stimulatory neurotransmitter, or it may release substance P, which is going to modulate the pain perception at the projection neuron. Very well, this is how we perceive the pain. Then when we are stimulating the skin areas around the pain, either by caring for it, cursing for it, or rubbing it, or applying any ointment which is kind of irritating, or you can say stimulating the nearby mechanoreceptors. So those stimulus, those receptors, when they are stimulated, they send the impulses via their A beta fibers or myelinated nerve fibers. What does these fibers do? They in turn stimulate an inhibitory interneuron. This is a inhibitory interneuron. So this, once they stimulate this inhibitory interneuron in turn hyperpolarizes the projection neuron. So it is, which chemical is being released here is an inhibitory neurotransmitter. Maybe it is GABA is released. So once this inhibitory neuron is stimulated, it causes the release of inhibitory neurotransmitter, which in turn hyperpolarizes the projection neuron. So what has happened to the amplitude or the volume of action potential? They get reduced. So once they get reduced, the perception of pain is reduced. So this is what is behind the gate control theory. Since it is forming a gate to the projection neuron, as if the stimulation of nearby fibers, which are being the non-nociceptive or mechanoreceptors, what do? They not only stimulate, what do they actually do is they stimulate an interneuron. Which in turn inhibits the projection neuron, the second order neuron. So the quantity of, the magnitude of action potential which is traveling along this projection neuron has got reduced, and the person feels less pain. That's what is the theory behind this. Since it is gating the number of volleys of action potential which has to go through these projection neuron, it is termed as gate control theory.